The Gauteng government claims to have doubled the hospital beds in the province, but goes on to say there is simply not enough staff to attend to the growing number of COVID-19 patients. Here's why. The province has recorded over 340,000 cases and almost 6,400 COVID-19 related deaths. It now has the second highest number of active cases in the country. I want to talk now to Democratic Alliance's member of the provincial legislature, Jack Bloom, who monitors the province's health system very closely. Jack Bloom, good afternoon to you and welcome. What's your blunt assessment? Do we now have sufficient bed capacity?
Well, there have been a number of extra beds created, but we were told at the Gauteng Legislature's Health Committee yesterday that about 600 of the promised beds that should have been completed in September last year are actually not finished. And I'm also very worried about staff capacity. We were also told at the Gauteng Legislative Health Committee that 983 community service nurses who were working at Gauteng hospitals up to the end of last year and should have been reappointed in permanent posts this year have simply not been reappointed, and apparently it's because of budget cuts. Now, this is just absolutely mad. I mean, here are newly qualified trained nurses, nearly 1,000, and we're not immediately re-employing them. So I'm just very anxious because it's not just a matter of having a bed available. You've got to have staff, equipment, and oxygen. And my other assessment is that some of the new beds are actually in the wrong area. There's 300 new beds created or supposed to be created at the Jubilee Hospital, which is in the far north of Gauteng. Only 95 of these are actually completed, and yet we've seen that the greater need is in the inner city of Tshwane, which is why Steve Biko Hospital has been overwhelmed. Surely those 300 extra beds should have been created at a hospital nearer the inner city. And we have another disastrous waste of money. I think it's going to be a White Elephant Hospital, the Anglo-Ashanti Hospital in a gold mine at Far West Rand, which was supposed to be renovated to provide 175 beds. Only 56 of these beds have been completed, and there's no staff there at the moment, and it's in the wrong area. Why didn't they build extra beds at, say, Lerotong Hospital? So I question where the beds have been created and whether they're really able to be used by the enormous number of new COVID-19 patients that are unfortunately flooding our hospitals.
So if the admissions trajectory continues to track northwards, and from what I'm hearing you tell me, we will get to a snapping point sooner rather than later.
Well, the Premier is correct. There are more beds now than there were at the peak of the epidemic in July last year, where we barely coped. So just to give you the figures, I think at the peak of the epidemic in July, there were over 7,000 patients in Gauteng hospitals, both public and private. At the moment, the figure is 4,700. But, you know, that can change very quickly. As we've seen in 1 week, there's just been a rush of new patients. And unfortunately, I think it's to do with this new variant virus. It's attacking younger people as well. So I think we must do what we can with what we have and direct people to where the beds are available. I think we need to have a proper bed management system, because it seems to me we've got available beds in one part of the province, but other parts of the province are heavily under strain. There's supposed to be 300 new beds at the Gauteng Hospital in Vereeniging. I hope that they are all operational. We need to take the strain off our hospitals by getting patients to available beds. But I'm also worried about the oxygen situation. We need to make sure that equipment is there and that people are able to be treated. But we may reach a breaking point, unfortunately, because I think we're only about halfway to when we'll peak, which will probably be in February sometime.
Much was made earlier during the first big lockdown about the status of field hospitals. Where do we stand with that?
Well, the Nasrec Hospital there was a contract, 6-month contract signed on the 1st of August till the end of January this year. 1,000 beds and also 500 quarantine beds. In fact, very largely unutilized. I think we may well need to use those beds now, so they're going to have to renegotiate that contract. But I think the problem with the contract is that we were paying for empty beds. It was a very one-sided contract. And I think the problem with the Nasrec beds is that are they properly staffed? That's been the problem all along. So I think we must find the staff somehow They have been doing a massive recruitment effort. I'm pleased at the situation that they managed to get more than 200 extra staff at the Chris Hani Baragwanath Hospital, and they have created more than 300 extra beds there. That's what should be happening, but we can't have a situation with empty beds, and we need to know exactly how to propose to use the Nasrec facility to best effect.
Jack Bloom, thank you very much indeed.